Hi, everyone. I'm Michael Uriarty or Dr. Mike, and welcome to Technique Talk, the MYK system, and more. This is episode 50. We hit a milestone. This is episode 50 in our series, and today we're going to interview Dr. David Garita, a functional medicine doctor. Today we're going to cover information from Dr. Garita's journey from chiropractic to his continued specialties of pediatrics, geriatrics, sports injuries, and functional medicine. Dr. Garita talks about the big technique, which he developed. Big is brain, immune, and gut, and how it's all intertwined together. We talk about how food and even emotions have an impact on the illnesses that we begin to develop as we age. He gives an easy to follow explanation of what he's looking for and how he corrects things within the body. You do not want to miss this. Check this out and you'll see. If you want more information about Dr. Garita, I have some links in the description below. Hit the subscribe button, like the video, share the video. I have a lot more interviews coming. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. All right, so Dr. Garita, tell me what got you interested into healthcare?
Well, first of all, Michael, thank you for inviting me for this podcast. And well, answering your question, what got me into healthcare is, well, I don't know if you've heard, but most of the people that decide to go into a professional career is because there's something that they want to fix in their own life, okay? That let's say there's an accountant. Well, that person wants to solve their problems in that aspect, okay? If it's a lawyer, they want justice and so on. So me, I was looking for something more holistic, okay? Instead of just going into one specialty like it's in other healthcare professions, I wanted to be an integrative, like from A to Z, right? And chiropractic got me very interested, and what it was challenging for me was that it was a natural way, right? That it was not about using any medication or surgical interventions, okay? So that's how I got started, and then I realized that, oh my gosh, I had many things to solve, because then I got into, I did a degree in pediatrics, geriatrics, chiropractic, sports, allergies, and now functional medicine. So that goes, like, oh my gosh.
That's so far. And so originally you ended up at Palmer College of Chiropractic in Davenport, Iowa. And first of all, but let me say this, based on what you just said, all of that you just said is after you graduated, you went and got those other specialties after you graduated, and more studying.
Yes, more studying, more certifications.
Something that is something I've tried to avoid my whole life, is that additional studying. So let me ask you this, because you were down in Monterrey, Mexico.
Yep.
And so how did you end up choosing Palmer College of Chiropractic?
Okay, that was, well, I wanted to go to the alma mater, okay, to the fountainhead. And for me, well, it's known that Palmer is the one. And at that time, there were 3 campuses, one in California, I don't know, it was just 2. One in California and one in Davenport, Iowa. So I wanted to be in the fountainhead, which is in Iowa, and that's why I chose there.
Gotcha. And so was it difficult, because English is your second language?
Exactly.
Was that difficult going through school?
Oh yeah. It was a challenge, because one thing is to be used to study whatever you do in your own language. And then another thing is to study in a second language, which included some nomenclatures or some words that were like totally out of my conception.
Right. I know I had a hard enough time just in English, so I can't even imagine having it be a second language. Right. So, all right. So let me ask you. So you did some of these studies. You said geriatrics and pediatrics and sports, and then now you've gotten into the functional medicine. So what drew you to the functional medicine part of it?
Well, I was looking for something that could integrate everything I was doing, okay? Because I had that itch in me that was telling me when I was treating my patients that I was missing something, okay? And functional medicine helped me realize how to connect the dots. Because when they teach you, and when you read any book, it's everything is like specialized, compartmentalized, Like if you want to learn about the heart, it's everything about the heart. If you want to learn about the GI tract, it's everything about the GI tract. But what's the connection between both of them? And that's what I was having a hard time doing. And functional medicine helped me to connect the dots.
So it's opened up your practice from what you were doing to a whole, I imagine it's just a whole nother level of care.
Oh, yeah. Oh, yeah. Oh, yeah. What I do now is not, of course, everything I have learned has become like a tool to me. Okay. I don't practice like chiropractic per se. I did like an integration of everything I have studied, and I developed my own, let's say, technique. Okay. Which integrates the nervous system, the immune system, and the gut. So we call it the big method, right? Like brain, immune, gut. Okay.
Oh, I gotcha. I gotcha. Okay. I like that. I like
Yeah.
that. The big
Yeah.
method. So I've watched some of your videos on LinkedIn. I've seen some of you post on there, and you may post on other places. Do you post on other places?
Yeah. TikTok, Instagram, Facebook. Um, I believe I'm on all platforms.
Oh, wow. Okay.
Yeah.
I
Yeah.
have a hard time posting to Instagram. I don't know why.
Well, see, I hire somebody to do that for me because I'm not
Oh,
very
well.
yeah.
Yeah. There's the difference. Levels, levels. Yeah, I see. But in your talks, you emphasize treating the root causes rather than symptoms. So walk us through some of that with like functional medicine.
Okay. Well, let me explain to you. Functional medicine is it's a model which is individualized, patient-centered, science-based approach that enables patients and practitioners, okay, to work together to address the underlying root causes of disease and promote the overall optimal wellness. Okay. But it requires a very detailed understanding of each patient's physical, biochemical, and lifestyle factors that are like leverages that data to direct a personalized treatment, okay, that leads for better patient outcomes.
So then not everybody's getting the same treatment.
Exactly. It's individualized.
Okay.
Okay. No two people with diabetes have the same root causes.
Gotcha. Gotcha.
Okay.
Gotcha.
Okay.
Okay.
So you have to be very, very personalized with each one of the patients and trying to be like 007, okay? Like investigator,
Right.
trying to find out what's behind the curtain.
Gotcha. I like that. I like that. Now,
Yeah.
you also mentioned four essential blocks. Are there four essential blocks and why they're game changers for chronic conditions?
Yeah. It's the physical,
Oh,
okay? Like, okay, the chemical, okay, emotional, or spiritual.
okay.
Like you have an upside of the body, you have a downside. You have a right side, you have a left. You have an inside, you have an outside. You have a physical body, you also have a non-physical body.
Okay. Okay.
Okay. And that's when you have to go into like what's called the energy medicine. Okay. The energy medicine is it's a new medicine of how to approach the human health and leaves behind the molecules
Hmm.
medicine. Everything represented in little balls,
Right.
like
Right.
this is calcium, this is iron, this is whatever, it's little balls, energy medicine is outside of that.
Okay. So,
Right?
so different than like acupuncture, because acupuncture is like an energy medicine,
Yes,
but
yes,
different, but different.
different, yes.
Yeah. Yeah. Okay. Okay. Um, so in some of your content, you explored, okay, again, how emotions
Yes,
can literally make us sick through that secret connection between the body and the mind.
exactly.
So what are some surprising ways that like stress or unresolved feelings show up as physical issues?
Okay. When we're talking about an emotion, let's break up the word. E, energy, motion. Okay, emotion. So let's think about that energy of the emotion is blocked. Okay, and subconsciously you tend to block it in that say um, chain loop that is your weakest. Okay, let's say that you're pulling from each side of the chain. Where is it going to break? In your weakest link.
Right. Okay, yeah, in the weakest link, yes.
The weakest link, it tends to break. So for some people, maybe the gut. For some other people, maybe the right shoulder. For some other people, maybe the left knee. Okay. And that emotion tends to blockage the flow in that area. And it's like a rubber band. It's not cutting off the circulation, but it's cutting off the energy flow. Okay. And look at your body like a suit, okay? Your earth suit, okay? And that suit, okay, it's susceptible. It may not end up your life, but if you have one rubber band that, let's say, is hurting your left knee, which your left knee is related to your emotional side, okay, your female emotional side, let's say that you are not very humble with your emotions. You don't tend to recognize that is hurting you, the decisions that you're making in your life, okay? You're going against your own self, okay? And that's stuck in that knee. And if you don't pay attention to the signs and symptoms, you may end up falling and hurting more that knee. And that knee is going to become swollen. And that's when you tend to see a doctor, right? And then you go to the doctor and you have a swollen knee with maybe a broken skin, and they're like, okay, let's take some x-rays and yeah, or an MRI. And they're like, oh yeah, you have this. But you're like, no, that's the end result of something that started in a subtle thing, but you never paid attention.
And so would you address the emotional component?
Yeah. I see all my patients like a tripod, okay? Like a three-legged stool.
Right,
The,
okay.
the chemical and the emotional, 33.3%, okay? And all my patients get treated on that same principle.
Okay. Okay. Gotcha. Gotcha.
Yeah.
I like that. All right, so this goes with, so you've talked about resetting the organism, resetting, I'm assuming the body, resetting the person with your
Yeah,
big method. And
exactly.
so, what does the process look like for somebody overwhelmed by modern life? What's,
Okay.
or just
Well,
what's the process look like for somebody? So the big method, one more time, what is big again?
it's brain, immune, gut.
Gut, brain, immune, and gut. Okay, I
Yeah.
love that.
Yes, yes. So, well, okay. All my patients have to take some x-rays that take into account how your body is supporting your weight. Okay, how the weight is distributed throughout the body. Okay,
Okay.
without x-rays, I don't treat you, and that gives me a very clear view of how is your blueprint. Okay, structural wise. Okay, the nervous system. That's what takes place, the nervous system. Then we go through a detailed understanding of your lifestyle factors and your biochemical factors. What you eat, what you drink, what's your lifestyle like, okay? Who do you hang out with? What do you do as hobbies? Everything. How is your work? How is your relations at home and your friends and whatever? We do like a very detailed examine.
Intake. Yeah.
Yeah, to bring out everything. I take a lot of attention on your body expressions. If you're talking like with you're like very proud of, or if you're talking like this, like you're not proud of what you're saying,
Right.
or if you tend to look away from me, or to the right or to the left, or whatever. Those are very subtle clues that give me an idea. How is your emotion behind all of this happening in your lifestyle? Okay. And then, okay, I explain them what my findings are, and I tell them that I'm going to be treating them from the physical point of view with chiropractic. Okay. The chemical point of view with a method that was developed by a doctor in Los Angeles, California. Her name is Dr. Devi Namrudiprad. And she developed this method that is called NAT, which stands for Namrudiprad Allergy Elimination Technique. And she is from India, but she integrated all her disciplines, because she studied a lot. She's a genius. And she she developed this method that takes into account that every energy that is blocked in your body is related to a allergy or a hypersensitivity from the physical, chemical, or emotional point of view. Okay.
Okay.
And with acupuncture, or with the principles of Chinese traditional medicine, okay, she developed this technique which can help you see the body as a computer, okay? And you know that when you have a computer, when you buy the computer, okay, and you want to turn it on at home, you have nothing in the computer. You have to download all these applications in order to work, right? Well, when we come to this world as babies, we come as the same way as a computer. We don't know how to speak. We don't know how to walk. We don't know how to do anything. We just know how to cry and poop and peep, right? Okay.
Yes.
So it takes us a long time to start to learn how to talk, walk, and do everything, right? And that has to do with the conscious mind, okay? The conscious mind, it's your creative mind, is your mind that is very slow in how it works, and that's why it takes us up to 1 year and how to learn how to walk in comparison to the animal kingdom, right? So the subconscious mind, that is now talked as the super conscious mind, that one is the one that has no influence from the conscious mind and works at the speed of 400,000 million bytes per second. Okay. And that's the one that takes care of your immune system, your digestive system, your cardiovascular system. You don't have to teach it. It just does it per se, right? Okay. So let's say that you want to eat, or you want to know if you are biocompatible with an egg. Okay. You just suppose that because you eat the egg and you don't have any stomach ache, you are biocompatible. But that's not how it works in your immune system. You got to remember that the brain, immune, and gut are interconnected. So that egg, if you are hypersensitive, you may develop like low energy, and you may be yawning all day because of that egg you had in the morning. Or it can trigger a knee pain, or it can be causing your skin issues or breathing problems or whatever, headaches, whatever, okay? Because we don't tend to think that that egg is causing that because it didn't give me a stomach ache. I can eat it. And they keep eating it. And they eat it for like the last so on of their life, right? So when they come to us, we tend to look at and take into account all those lifestyle factors. And we're like, oh my gosh, that's what's feeding the monster inside of you. That's what's causing all the symptoms or developing the chronic diseases, right? That's why you've been to all these other doctors and you haven't been able to solve your root cause, okay? So since we're talking about, let's suppose an egg, that egg has an energy field, and that energy field has to be compatible with yours. But let's say that when you were a young kid, you got yelled by, I don't know, whoever you want to choose, okay? While you were eating that egg and you created an emotional rubber band tied to that egg.
Okay.
And that had to do with, let's say, that you were doing bad in your soccer match, okay? So you tend to connected that egg to the soccer. So when I run, if I eat egg and I run, my body tends to remember that event. Even though I don't have it present consciously, my subconsciously does, because we are like a memory of everything we have learned from our first day, right?
Right.
That keeps, bringing it up little by little. And let's say that later on in life, you broke up with your girlfriend when you were having egg. And let's say that you got fired later on in life when you were eating egg also, okay? So all those events keep just adding up, okay? So that's why when you are like, I don't know, whatever age, 50 or so, okay? You have developed this chronic disease that nobody has been able to find out what it is. And that's what reprogramming it's about. Like deleting all the information that you have stored in relation to that egg and giving you a new, brand new computer in order so you can eat that egg and doesn't harm you anymore.
So
And
then
that's what,
it's
yeah,
not necessarily that you're testing for like a food allergy. You're doing a different type of test. You're doing something else to figure that out.
exactly. Because as we know now from science, food allergies are limited to the immunoglobulins, okay? IgE, IgE, IgD, IgM, IgA, whatever. But that's limited to the physical component. Okay, we're talking about the little balls, right? Remember what
Right.
I told
Right.
you? And nowadays we know that. How do you detect an energy susceptibility, okay, or weakness? How do you detect a weakness to the egg that doesn't show in a lab test, like blood test? The only way is to do what I do is muscle testing, okay? And I ask, is it physical? Is it chemical? Is it emotional? Is it related to something you eat every day? Is it related to something you breathe at it every day or do you wear every day? You know? So that's kind of what we do in the individualized, patient-centered, science-based approach.
Gotcha. That is fascinating. Yeah,
Yeah.
that is
A
fascinating.
little bit complicated to explain it, but once you get the whole picture, you're like, oh, it's easy.
Yeah. All right. So along those lines, so growth hormone, I've heard you
Yep.
say growth hormone is key for energy recovery and aging gracefully. So are there some natural ways? Because I know that you can take something, right? I think they have growth hormone that people
Yep.
take, which is I don't even know if, that's good for you. But then there's natural ways, or are there natural ways to increase that?
Well, see, going back to the nervous system, we know that the autonomic nervous system is subdivided into two. One we call the sympathetic, and the other one is the parasympathetic. The sympathetic is your, let's say, what keeps you alive, right? Fight, flight, or freeze. Okay. So that tends to segregate in your blood flow everything that you need to run away or defend yourself against any kind of situation. Okay. So you need glucose as energy. You need low density lipids as energy. You need cortisol. You need adrenaline and noradrenaline, right? But those belong to the sympathetic. Okay. The parasympathetic is the one that is in charge of your digestion, your rest, and your repair. And what do you need to do that? Well, you need digestion. You need your gut, right? You need to be able to have certain degree of acidic pH in your stomach, no more than 3.5, to be able to absorb everything you eat, okay, and assimilate, okay? And then you need, for repair, you need the growth hormone, right? So you can't be in alertness and fight, flight, or freeze in order to have the growth hormone. You need to be in a peace, okay? So that's why the physical, chemical, and emotional stresses get you into sympathetic, dominant sympathetic, and away from parasympathetic. And the growth hormone belongs to the parasympathetic, as the sex hormones, as the melatonin that helps induce to sleep, you know. So it's all about, are you dominant sympathetic or you are dominant parasympathetic from the physical, chemical, and emotional standpoint.
Okay. And
Okay.
so I think this next question leads right into that, which is we know that nutrition plays a big role. So how do you personalize eating strategies to balance hormones or support the gut health? Especially with all the processed foods, it's so easy to go buy something in a package and open
Oh,
it up and eat it.
ooh. Package. No, no, no. That's a big no. Everything has to be from Mother Earth. But okay, going into that, okay, you have to take into account that in order for me to digest and assimilate all nutrients, I have to be in dominant parasympathetic, right? So I need to address all those aspects that are keeping you away from dominant parasympathetic. Okay. So all physical, chemical, and emotional issues that have you on fight, flight, or freeze are contributing to your digestive problems. Okay. And it's essential for you to get those nutrients because that's going to be the materia prima, which is called the founding blocks in order for you to produce, let's say, neurotransmitters, hormones, and everything else that you need, your body needs. Without that essential nutrients being able to be digested, broken down, and be assimilated, because one thing is to eat it and another thing is to assimilate them, okay? You won't be able to have the end product, which is, let's say, a hormone. You know that for hormones, an essential nutrient are fats, okay? In this case, cholesterol. And you know, cholesterol is very satanized, you know, it's like a bad. And no, you need cholesterol for all cell membranes. You need cholesterol for all neurotransmitters, hormones. You need cholesterol as fuel for your brain. You need cholesterol to absorb liposoluble vitamins like A, D, E, and K, right? You need all of that, okay? And where is your body going to store those vitamins? In the liver. Why is it called the liver? Because that's how you live. Liver. Take the R. So if you cut that word also and you have liver problems, you have a restricted life, right? Liver. You cut the R and you're like restrictive life, okay? So, and what do we know about the liver? Well, it's the factory of your body. What do we know about the adrenals? That's the pharmacy of your body. What do we know about, all those different points? So you're like connecting the dots and you're like, oh, that's why this guy is like, I know, in chronic fatigue or adrenal fatigue. Oh, because his main issue is addressed to the adrenals. And you're like, okay, what are the adrenals needed for? Okay, the adrenals are needed for to make hormones, all hormones. Okay. So you're like, oh, no wonder. Like an essential nutrient to make thyroid hormone and to make adrenaline is tyrosine, which is an amino acid. So your body has to determine if that tyrosine is going to be used to make adrenaline or thyroid hormones. So when you present, let's say, a thyroid problem, it's not necessarily a thyroid problem, like a gland problem. It has to do with the whole picture.
Gotcha.
Do I
Yeah.
explain myself? Yeah.
No, that's fascinating. Yes, yes, that's good. That's good. So let's shift it just a little bit. We're going to go allergies.
Okay.
So from an allergic reaction, allergies have hidden triggers that a lot of people ignore. And you've pointed out some of the triggers. It could be like on your skin. It could be the stomach ache. It could be the right. It could be the different thing. So
Breathing.
what are some of the most overlooked from an emotional or an environmental standpoint? What are some of them that are overlooked? People don't think about. They're like, oh, that couldn't be an allergy for me.
Okay. When we're talking about the immune system that belongs to the allergy system, okay, we have to divide the immune system into two. Okay, one we call the innate immune system, and the other one we call the adaptive. Adaptive. Okay, the innate is the Th1, and the adaptive is the Th2. Each one of them looks like like that playground.
Like a seesaw,
Yeah,
a
yeah, yeah, yeah.
teeter
More
totter.
weight
Yeah,
to this one or more weight to the other one. Okay.
yeah.
When your Th1 is activated, the Th2 is suppressed, and vice versa. Okay. And the Th1, which is the innate one, tends to be, let's say, deposited or is mainly present in your hollow organs. Which are your hollow organs? The frontal sinuses, the paranasal sinuses, your digestive tract, breathing system, and your bladder. And that's the one that usually comes out as the white blood cell count in your CBC. Okay.
Okay.
Complete blood count. Okay. That's the Th1. And that one, its response, it's humoral or cellular. What does that mean? Well, it means you create mucus, you create cough, you create vomit or diarrhea, right? And the Th2, which is your adaptive, that is represented by the immunoglobulins, okay? That tends to react in an inflammatory way. Let's say when you cut yourself, when you hit yourself, or if you got a mosquito bite or a dog bite, it's inflammation, okay? Inflammation. So if you are, let's say, eating all the time, one common food that tends to inflame everybody, gluten, okay? Gluten is going to create a digestive issue, which is going to create an inflammation, okay? So you have to think of yourself, why is my immune system reacting with a Th2 in a Th1 zone? Instead of giving me a diarrhea or vomiting, okay, why is it creating a gut issue? I'm all distended, I'm creating gas or whatever. Well, it's because the lining of your gut is so thin that it got cut. Okay, gluten is cutting it from the inside. So that's why your immune system is reacting with a Th2 type of response. Okay. So no matter what you do, let's say that you suppose I'm going to eat this gluten-free product. No, the body has created a memory towards that item. And that's when it comes in between or crosses the molecular mimicry. Okay. It's not the same, but it looks the same. Let's say that when you were a kid, you got bitten by a Chihuahua dog. Okay? No. A Doberman. A Doberman. So you
Okay.
were a kid, you were little, and the dog was big, right?
Okay.
You suffer a lot. Okay? But then later on in life, you are at some friend's house and you have the Chihuahua barking at you, right? And you react. Why? Because subconsciously, you're like, that's the same dog that beat me when I was little. Even though the animal is, the opposite. Now you're big and the animal is little, but you react. Why? Because you had an experience. It's not the same dog, but it looks like. In your immune system, well, here I have to make a stop and be like, okay, which are the only two systems that are always in alert from your outside body? Nervous system and immune system. They're always watching if you're in a safe place, if you're breathing pure air, if you are hot, warm, whatever. Immune system and gut system. And who is coordinating them? The brain. Okay? So if you, let's say you're too cold, the least thing you think is, oh, I'm hungry. No. Or if you're like very deep into work, that's why we can explain and be like, oh my gosh, I haven't eaten in so many hours. Why? Because you're in sympathetic, right?
Oh, I gotcha. Yeah.
Okay. So when you're talking about food allergies, emotional, so whatever, that's what you have to dig behind and be like, okay, what's related to that situation or symptom or condition or whatever. Okay. So when you find out everything that is involved in that, it's like you treat the root cause. It's like you're reprogramming the whole mind response to the nervous system, and that's how you can achieve the optimal over wellness, right?
Right. So going or getting someone out of the sympathetic into the parasympathetic is kind of a big portion. That's a
Yes,
big step with this.
yes. Usually my treatments take into account what's a normal body process. Nothing is done like this. It's a normal body process. It's like in order to have a baby, you need 9 months. It doesn't matter religion or what you speak or your, what kind of skin you have. It's 9 months going to be here and anywhere, right? Or let's say that you have a broken bone. Well, depending on which bone it is, it's going to take you from 4 weeks to 12 weeks, right? It's not like it depends on the doctor and the doctor's going to do some voodoo things and I got you ready tomorrow. No. It's a body process, right? Or let's say you want to join the gym and you want to have a six pack on your tummy, right? It's hard work. Nothing is giving up like this. It's hard work, dedication, concentration. Change your lifestyle factors that have been keeping you like the way you've been for the last so many years or so.
I gotcha. So it's okay. Yeah, you really are like a detective going in and trying to figure out what's
Oh,
going on.
yeah, most of my patients take at least 6 months in order to conclude their treatments.
Okay. Okay. Oh, that's good. That's good to know that's the process. So
Yes.
don't go in and expect like on Friday and then Monday you're like, got it, done. Yeah.
Yeah, you may feel better. Yeah, I'm not gonna say that your body is like when you're like tired and you get your girlfriend or your wife doing the like the scratch. You feel good. I agree. It's like the
I,
honeymoon
I have not had that in a while. I don't have the hair anymore to do that. So it's
effect. But what I mean is like, yeah, it feels good, but that's what I call the honeymoon effect. Okay, it's gonna last a short time. You want it to
right.
last a long time. You
True.
need, you know.
True. That's true. That's a good point. That's a good point. So, with the skin, if we go back to the skin and the dermatitis and things like that,
Okay.
you've said a red flag would be like the redness or the itching or something like that.
Okay.
So, what root causes do you see a lot in your practice? So, what would be a root cause of something like that?
Okay. The ones I see the most are the gluten, dairy, egg, Um, okay, gluten is represented by 7 different names in all grains, and grains are included corn, wheat, um, rye, um, oats, rice, and I'm missing one.
Do you eat, let me ask you, do you eat gluten?
I try to avoid it as
So
much as.
you try to avoid what you just named off.
Yes. Yeah, I try
Wow.
to avoid it as much as possible because nowadays with all these agriculture technologies, which include a lot of pesticides, herbicides, and all that stuff. If you break up the word, pesticide is like suicide of pests. Herbicides is suicide of herbs, So, and we have a gut microbiome. So when you eat the stuff that has been sprayed with that thing, that's killing your microbiome, which is maybe causing like the lacerations in your gut lining, which may be causing your immune system to, exacerbate like that, and react like that.
And then
But you
you end up
also
with
have
a red spot or an itchy spot.
but also you need to take into account your cleanse pathways or detox pathways.
Okay.
And I would like you to imagine like a funnel, okay? On the top side of the funnel is your skin and tissues, your cells and tissues, everything. Okay, everything that comes into your body comes from the widest part of the funnel, right? On the top. From there, has to go into the second layer, which is your lymphatic system. Okay. Which let's think about if it's not as aggressive what you're exposing yourself. Okay. Your body tries to cleanse your body using the lymphatic system. But you know that for your lymphatic system, you need to move, you need to exercise. Okay. And that's going to be dumped ultimately in your colon. Okay. But let's say you jump that step and you went into the next level. And the next level, it has to do with your kidneys and your skin. So you either pee or you sweat. Okay. Okay. And if everything okay, let's say it was something more aggressive, which your body cannot take it out via the lymphatic system, the kidneys, or the sweat, then it degrades it down by using the connection between the liver and the gallbladder. Okay. And that's when it degrades it by 3 different steps and dumps it into your colon, and then you poop it out. Okay. But most people nowadays are constipated. Okay. So that's going to block me my way of eliminating via the colon, right? And all that stays in my body. So then it's going to block up the next level above. And which one was it? Oh, it was a relation between liver and gallbladder, right? And the body is like, no, 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 no. That's my liver. That's my fabric. I cannot leave it there. So it goes sideways and it goes to the next level. Which one is it? Through the blood. Oh, the kidneys and the skin. You're like, oh my gosh, that's when I eat that. I cannot pee it, I cannot poop it, and I have itchiness, scratchiness, eczema, psoriasis, rosacea, etc. Right? And
Right.
you're like, oh my gosh, everything that had to be left out of my body through the colon since I'm constipated, now it's reacting on my skin.
That
But
makes
it has to do with that funnel. Okay.
yeah. Yeah.
Now, sometimes you have heard about people that suffer from lymphedema, inflammation of the lymph nodes. So you're like, oh my gosh, all those steps are blocked. Do
Okay.
you
Yeah.
okay? So you have to take into account everything. You're like, oh my gosh, where is it blocked? Is it blocked here? Is it blocked there? Are we lacking of some nutrients in order for the liver in conjunction with the gallbladder do itself? Or let's suppose that you had a gallbladder ectomy. So you don't have no longer the gallbladder. Well, that doesn't mean that you don't produce bile, but it's constantly dripping into your large intestine, right? So you're like, okay, so that's why I have diarrhea. So you're not okay. So you're like, okay, I have to help this person some way, some way. Okay, so you see the connection? It's like, oh my gosh. And maybe the emotional issue with the skin, well, the skin is your ultimate barrier to the outside. So maybe you're shy, or maybe you don't want to get too close to other people, and that's why you develop that eczema and stuff. You don't want to look, you know, beautiful or gorgeous to the other person, and that's what's keeping you away from enable to get married, to have a girlfriend or a boyfriend or whatever. Subconsciously,
Right,
subconsciously, you have the perfect excuse why you are in the situation where you are.
right,
Of
right.
course, it's not conscious; it's subconscious.
Yeah.
Okay.
I like that explanation. That was a great explanation of how that worked. That was good. That was good.
Thank you.
All right. So without giving up like personal information about a patient or something, do you have a story about just a situation like somebody that came in, they had a certain issue, and then you went through the different steps and then they got helped? Is there a condition, something that you've dealt with?
Okay. Yeah. Yes, I have plenty. I've been practicing for quite a few years, so I have plenty, but I'm gonna,
How long, let me ask you real quick, sorry. How long have you been doing the functional medicine? Because I know you've been a chiropractor for how long?
I don't know. I lost count.
There, I'm going to say roughly 30 years,
Yeah,
roughly.
roughly. Yeah,
I'm
yeah.
going out on a limb. I'm throwing that out there. And so, but from a functional medicine, first of all, did you take that also in the United States?
Yes, yes.
You did
Institute
that
of
in
Function.
English as well.
Yes, 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 yes.
Wow. Okay. And so, and roughly, how long have you been doing that?
Probably for the last 10 years at least.
10?
Yes,
Yeah,
10
10 years.
years.
Okay. All right. So, all right. So then,
I started introducing it little by little, okay, into my practice because I'm always like, okay, I have to do it on me in order to be able to treat it on my patients. I always go like that. I'm very critical, analytical, and concrete thinking. Of all the information there is out there, I'm like, okay, I'm going to see if this replicates. Okay. And if it applies, I'll use it. And if it doesn't apply or replicates, I will not use it. Okay. So even though I have certified in functional medicine, I'm not a usual functional medicine practitioner because I have included all the other tools from my previous,
I got you. Yeah.
certifications. So that's why I say I have developed. I have the functional medicine approach, but let's say to put out something there on the table, genetics. Genetics nowadays, we know to some point that is not what they tell us it is. Your genetic sequence, first of all, your DNA is like an antenna. Okay. So if it's like an antenna, you're like, okay, let's say I have a cell phone and my cell phone here has an antenna that can receive and transmit data, right? Or images or voice or whatever. But let's say I go into a cave, okay? And I'm in the cave and I have no reception and I cannot communicate neither receive information. Does that mean that my DNA or the cell phone DNA has changed? No, there's some blockages in the cave, right? And that's why it can't get the connection, right? With the satellites or whatever. So I'm like, okay, your DNA does not determine you, okay? What determines you is your epigenetics, what is above your genetics, okay? And you're like, okay, if it's above my genetics and I'm looking for blockages of information, in this case, energy information from the physical, chemical, and emotional point of view, I tend to address it in the way that I just explained it, right? But Um, okay, but let's go back to the question, the
Yeah.
original question, which was about
A patient or
a
a,
patient. Okay. I have the one case where this lady, she's roughly around 65, almost 70 years old, And about 10 years ago, she started losing her eyesight. Okay. And she, of course, what she did, she went to the eye doctor. Okay. And the eye doctor did an enormous quantity of tests. And all he could find is that she was not projecting the light from the outside. So that's why she cannot see clear, because her brain, the backside of her brain, wasn't interpreting that, was not being able to translate that information that came through the eye. According to him, there's no damage to the optic nerve or anything structural. So he could not explain what was happening. And all he told her is like, you have some kind of inflammation. Okay. So she was struggling, and each year went by, she was worse and worse and worse, to the point that she could not walk without going like this. She was becoming blind little by little. Okay. So she was recommended to me, and I'm like, okay, you have, I mean, my let's say diagnosis, which I don't use diagnosis, but I told her that you have some structural changes that are blocking the way your brain should communicate with every single further aspect of your body, your brain with your body, right? So I'm like, okay, the eyes are like in the same tissue as your brain. Okay. So this means that whatever is blocking you from having a good eyesight has to do with inflammation in the brain, but in this case, in your eyes. So we know that the eyeballs are very low blood flow. Okay. They have very low blood flow, but they are high demanding. Okay. So you're like, okay, we know this, and we're like, how can I make more blood flow go to the eyeballs in order to clear that blockage without having her had red eyes, because when you see that people have red eyes,
Right.
you have to think that toxicity is in the brain. It's just manifesting in the eyes. Okay. So let's say that some people go out at night, they have a few drinks, they party all night long, and next day they wake up with a red eye. So that's the explanation. What that toxicity hit your brain, but it expressed also in the little vessels in your eyes. Okay. But she didn't have a red eye. So I'm like, okay, so we have to take into account that whatever is blocking her eyesight has to do in a subtle way that is not enough to break the blood vessels and give that red eye. So we've been working with her, and we, of course, got her into the pro-inflammatory diet. No, modulated anti-inflammatory diet. Okay, we took away everything that was inflammation that we know. Okay, like gluten, dairy, what else? Vegetable oils, artificial sweeteners, the processed and ultra processed foods, everything like that, colors, everything like that. We got them into our organic, the most clean diet. And we started supporting her system with supplements like vitamin C, quercetin, rutin, everything that we know that's going to help the inflammation to reduce. Okay. And we start triggering everything from the physical, chemical, and emotional point of view that had to do with the blockages. And in this case, she was a divorced woman and remarried, but she had some issues with the previous husband. And before that, she had some issues with her family, that mom and dad and siblings and whatever. So everything, we started cleaning that from the physical, chemical, emotion point of view. And now she can drive.
Wow.
And the doctor, her doctor keeps seeing her, and she's like, whatever you're doing, keep doing it, because I can see that you are getting clear colors, and now you're getting images, and you're becoming better. And she hasn't told the doctor what she's doing, because here they're very jealous. They can cause
Right.
some problem.
Right.
Yes. But she's happy, and now she's no longer dependent on her driver. Now she can drive by herself. Before that, her husband used to hire a chauffeur to take her everywhere she needed to go, and she was like almost like a blind guy, I mean, a blind lady, she had to like, I want to buy this, and the other person, the chauffeur, had to tell her, okay, this is this and this is that, and based on her previous, she will be like, oh, okay, I remember, I will choose this. Now she can do it by herself. Now she walks without going like this, and now she drives. She's been doing all that, and that's all we've been doing, clearing up every blockages that have been established there. We haven't done yet. I mean, but she's at least she has gained her eyesight to at least 60%.
Wow. And so
In,
how long
in
of a
this,
time frame?
yes, it has been like a year and a half.
Okay, that's
Yeah.
phenomenal.
Yeah,
Yeah.
yeah, because I mean, compared to the 10 years where she was going bad down the hill.
I was just gonna say because she's probably thrilled
Oh,
that
yeah. Oh,
that
no.
yeah, yeah, yeah,
She's
yeah.
like addicted to me now. She's like, she's so happy. And like her, I have some other ones, but that was very interesting to me because I was like, it's the eye, you
Yeah,
know? And
yeah,
usually people with eye, all they think is, I need surgery or I need glasses or whatever. And you're like, no, not necessarily.
right, right. People always ask me, they're like, how are you so old and you still have 20/20 vision? And I'm like, well, my arms are still long enough. I can still read, when I put it out there. I'm still good. I still got 20/20. So
Awesome. Awesome. Awesome.
I'm an anomaly. So
One of the few, the lucky ones.
that's right. One of the lucky ones for sure. For sure. All right, that was fascinating. That was very good. I'll tell you what you're very good at is giving a description,
Right.
like the funnel description and the things like that.
Okay.
You are very good at giving a visual description of that so that you can go, oh yeah, I can follow that. And that
Yeah.
was that was good. You're
Thank
uh
you. Thank
you're
you.
very good. And the fact that this is English is your second language, you did a fantastic job. I struggle with English, and that's my first language. So
Oh,
uh,
Michael, you do
I'm
not.
impressed. I'm impressed.
I have
So
to learn this because going back to when I was in school, I was like, okay, getting information from doctors that were not English spoken. Like you remember the Indian doctors, okay? And I was like, holy, what she's saying, what I have to translate, and I have to like, okay. And then it was enough, being a subject totally out of my, knowledge. So I was, once I got done with school and once I got done with everything else, and I came to the functional medicine part, I was like, damn, I mean, if it's hard for me to understand it, how is it for a patient? So I put myself in their shoes and I'm like, I have to translate all this information in a simple way. And that's how I started developing these different, analogies, if you want to call it like that, where I can make it more digestible for them,
right,
you know.
right,
And once you put it out like you just said, like I just do, they are like, oh my gosh, I can understand now. But finally, you don't have some fancy words and stuff like that. And I'm like, I don't need the fancy words. The fancy words gave me a headache. I
right.
want to be able to talk to you in regular language.
Right.
And
Well, and then it makes it so the patient understands why they need to come back, why they need to continue with care. This isn't fixed yet. The funnel's not clear yet. And they go, "Oh yeah, that makes sense." And yeah,
yeah,
that was
yeah.
that was fantastic. That was fantastic. I learned a lot. I learned a lot
Oh, good.
from that. So that was good. Um, I would we're gonna have to talk. I would love to have another conversation with you.
Of course, as many as
So
you want.
yes. So, all right, very good. I appreciate you coming on here, and so yeah. But we'll be back in touch again. So thank you.
Thank you, Michael. Thank you.
If you made it this far, smile.